my role is really to give you a short background about the Directorate of Women's Health, and we were formed in the year 2017. At that time, the newspapers were full of negative stories on the front. We had a number of maternal and neonatal deaths. They were very high profile. And in 2015, Trinidad and Tobago had failed to achieve the goals, the targets that were set for the Millennium Developmental Goals. So this unit was formed in 2017. However, in 2015, while we were waiting for the unit to be physically formed and me to come into the post, the Honorable Minister took it upon himself and assumed the portfolio and conducted all of the affairs of the Directorate on his shoulders from 2015 to 2017. And he continues to push me in every direction, everywhere, makes me do a lot of work. So it's quite true, yes. So as I said today, we're here to celebrate and recognize the achievement of not just the Ministry of Health and the stakeholders, but to celebrate Trinidad and Tobago and its recognition by the Pan American Health Organization and the World Health Organization on its significant improvements over the last few years in the area of both maternal and newborn health. In terms of what does it really mean to the common man, as I always say, at the nation's hospitals, you'll see visible improvements in front of you as well as behind the scenes. There's improved customer services. There are more senior staff present. There's more accountability, and that transcribes to improved patient care and improved patients' outcomes. We do a lot of work at the Directorate from matters concerning breastfeeding, health promotion, vaccination. We are working right now on the elimination of cervical cancer and the elimination of mother-to-child transmission of HIV and syphilis. I also need to advocate, if you go to the Ministry of Health's website, there's a lot of information. You don't need to file a Freedom of Information Act. It's all there. We are very transparent. We have a whole page dedicated to the women's health issues. All of this information is available free to the public, as well as all of our new policies and guidelines. So coming back to that 2015, so since 2015, we have actually reversed those negative trends when it comes to maternal and neonatal outcomes. And I'm sure Honorable Minister will speak about some of the statistics. Nameless to say that the confidence in the public sector in maternity units are very high, with over 91% of our population delivering in the public hospital. And I believe that deserves a round of applause. And when it comes to neonatal service improvements, you must realize that in that 9% who choose to go to the private sector, there's no neonatal intensive care unit in any private health facility. So all of these high-risk mothers and all of these complicated cases when it comes to the babies must have their care in a public hospital neonatal intensive care unit service. And for those improvements, we have to thank Dr. Marlon Timothy, who is our neonatologist in Trinidad and Tobago, and of course, all of the teams in the antenatal, the prenatal, doctors, nurses, midwives, all of the support staff, executive, and so on. So there have been a significant amount of improvement in the services. I have some key messages that I need to let the public be aware of. And we are asking the public, not just women, their partners, their family members, we want to encourage you to get all women looking after health-seeking behavior, especially so if you're pregnant. I already said that 91% of persons deliver and access the public health system. One of the problems we have that the private sector may not face is that of those patients, only 40%, that's 4 out of every 10 women, will seek antenatal care in the first half of pregnancy. By the time we see them in the public sector, the damage may have been done. They have missed out on all of the basic health investigations, health examination, in terms of blood tests, ultrasounds, and so on. So only 6 out of every 10 present 4 out of every 10. So we're missing a significant proportion of patients. So I need for everyone to educate themselves to seek early antenatal care. And it's even more so, I am asking persons who have health issues. We are always talking about the chronic non-communicable diseases, diabetes, hypertension. Some persons have heart disease and so on. You know you have these conditions, but yet you do not plan the pregnancy. So the healthcare workers, they face on a daily basis these very ill patients who now have pregnancy, which puts added demand and adds to worse outcome. So we are asking those patients to have health-seeking behavior, reduce obesity and so on as well before getting pregnant. In terms of the neonatal unit, so just to touch on Marlon's point, unfortunately, as you heard, he lost his voice today, which may be a good thing, but he's always full of words. So today I get the opportunity to talk about the good work that he's been doing. So when again in 2015, when we started here, we found that the neonatal mortality rates were as high as about 12 cases per every 1,000 live births. And that figure has significantly improved. Since then, we are now looking at, on the last couple of years, at about 7 cases per every 1,000 live births. That's a remarkable achievement, which is what the Millennium Development, the SDGs, the Sustainable Developmental Goals for 2030, that's the target that our region is supposed to achieve. So we have done this so many years beforehand, and that again deserves a round of applause. So in closing, I would just like to again recognize all of the persons in the room here who have contributed to these improvements. It's not just about the work done at the executive level and the Directorate of Women's Health. I also want to say a special thanks to one of the speakers on today's list here, Ms. Isola Garcia from PAHO. It's not just about PAHO, it's about persons in PAHO. She has been driving all of the things that you see here and all of these improvements for many years, even preceding my tenure here. So please give her a round of applause. And of course, in closing, and last but not least, I want to say thanks to the Honorable Minister of Health for being the catalyst and the driving force since 2015, not just improving maternal and newborn health, but improving the health of the entire population. Thank you very much.